Hi, it's Mary, a traditional Chinese medicine tutor and an acupuncturist in Canada.
The methods of taking and analyzing women's pulse are the same as for any adult, with no difference. One must keep in mind that gynecological disorders such as menstrual disorders, leukorrhea, are external manifestations of dysfunctions in the kidneys, liver, spleen, the Chong, flush, and Ren, conception vessels, and Qi in blood. As the roots of gynecological disorders vary, so do pulse conditions. It is not surprising to see that by fixing the functions of the liver, spleen, and kidney, etc., to fix gynecological disorders. 2 clinical cases of treating menorrhagia and dysmenorrhea are discussed in detail.
Old days, there's no modern technology to test women pregnant or not, or whether or not they are going to have a labor soon. Old ways are using pulse taking to gather those information. But now it's so easy and straightforward to find out whether or not pregnant or the time for labor. So we're not going to go through this part. We'll just talk about taking pulse, showing the conditions of menstruation. For a healthy woman, the pulse condition is often slippery and rapid during menstruation, signifying harmony of qi and blood. Because during menstruation, usually the qi and the blood are more sufficient. Therefore, the pulse condition is slippery and rapid. That's a good sign.
Hi, Mary. I have a question regarding abnormal menstruation and its pulses. Are these disorders associated with specific pulse patterns? Can the etiology of a menstrual disorder be diagnosed solely from pulses?
The answer is no. Menstrual disorders, such as in early or delayed menstrual cycles, menorrhagia, amenorrhea, or dysmenorrhea, are external manifestations that reflect internal disorders of the Zang organs, meridians, and the state of qi and blood. Although the disease appears to occur in the uterus, the formation and the regulation of menstruation are closely related to the kidneys, liver, spleen, the Chong and Ren vessels, and the state of qi and the blood. The kidneys store Jin essence. Only when essence is sufficient will Tiangui appear, and menstruation can occur in women. The liver governs the free flow of qi and stores blood. The spleen is the source of producing qi and blood, and keeps blood within the blood vessels. Additionally, menstruation is also related to the heart. As stated in Plain Questions, Chapter 33, the uterine collaterals belong to the heart and connect with the uterus. The uterine collaterals are the collaterals distributed in the uterus, which include the Chong and Ren vessels. The primary function of the uterine collaterals is to regulate women's menstruation and support the development of embryos and fetuses. Therefore, any disorders of the Zang organs, channels, and qi and blood, such as qi and blood deficiency or stagnation, deficiency or excess cold or heat in the blood, disharmony between liver and spleen, spleen and stomach qi deficiency, liver and kidney deficiency, liver qi stagnation, etc., just to name a few, can lead to menstrual disorders, which always have deficiency pattern and excess pattern. Accordingly, the pulses at the 6 portions on both hands present different patterns in response to the internal pathological changes. As a general rule, one must integrate overall signs and symptoms with the pulse conditions to find the root syndrome and treat accordingly. The menstrual disorder as a branch or secondary problem will be solved following the root problem being solved. Below, I will discuss two cases recorded in Pu Fuzhou's clinical experience to illustrate the clinical application of pulse diagnosis in women. Mr. Pu Fuzhou is a modern TCM master, widely recognized in China as a leading figure in traditional Chinese medicine.
Case study number 1, Menorrhagia.
Mrs. Dai, 28 years old. First visit, March 2nd, 1957. Each menses is delayed 7 to 9 days, with very heavy bleeding. Dark purple blood with small clots, lower abdominal pain with a drooping sensation, dizziness, and cold sweating. Pulse conditions. Both chun are wiry, large, and raising. Guan and chi are both deep and weak. Tongue coating is yellow and greasy. Syndrome concluded is qi deficiency with deficient heat in blood, showing a tendency towards profuse bleeding. Based on the syndrome, the treatment principle is to tonify qi and stop bleeding. Second visit, March the 6th. After taking herbal medicine, the menstrual flow became less than before, and the color became red. Abdominal pain resolved. Appetite is poor. A distension forehead headache is present. Yellowish and whitish leukorrhea has increased with a foul fishery odor. Pulse conditions. Chun and chi are deep. Right guan is deep and slow. Left guan is deep and wiry. The syndrome concluded is liver-spleen disharmony. Thus, the treatment principle is to harmonize the liver and the spleen. Third visit, March the 9th. After taking medicine, some pieces of necrotic tissue were discharged. Menses stopped. Lower back and lower abdomen no longer painful. Only frontal headache and general fatigue. White leukorrhea persists. Yellow, greasy tongue coating reduced. Pulse is wiry and moderate. The syndrome concluded is spleen and stomach disharmony. The treatment principle is to strengthen the spleen and harmonize the middle jaw. The fourth visit, April the 1st. Menses recurred on March 29th. The flow was very heavy for the first 2 days, then decreased on the third day. The blood color is normal with small clots. There is no abdominal pain. A sacral dragging sensation exists. A headache is present. Appetite is poor. Tongue coating is yellow and greasy. Pulse is wiry, slippery, and forceful. The syndrome concluded is heat in the blood with damp stagnation. Treatment principle is to harmonize the blood and clear damp heat. The root of the case is that deficient qi fails to control the blood and deficient heat arising internally, manifested as heavy menses. Following the principle, treat the manifest first when acute, treat the root when chronic. The initial treatment strengthens the spleen to tonify qi and nourish blood, and at the same time clears the deficient heat from the blood to regulate the cong and ren vessels. Subsequent treatment is focused on strengthening the spleen and harmonizing the liver to consolidate the root of menstruation. Note that during treatment, the patient's visceral function and the qi and the blood condition changed, and the pulse patterns changed accordingly rather than remaining fixed. First visit, both chun is wiry, large, and rapid, with guan and chi deep and weak. Second visit, chun and chi are deep, with right guan deep and slow, and left guan deep and wiry. Third visit,
the pulse is wiry and moderate. Fourth visit, the pulse becomes wiry, slippery, and forceful. This case nicely illustrates a key TCM idea. Menstrual disorders are the exterior manifestation, and the root lies in the conditions of Zang organs, meridians, and qi and the blood. The menstrual disorder resolves following the solution of the root problem.
Case study number 2, Dysmenorrhea.
Mrs. Rong, 33 years old. First visit, March 10th, 1958. Since an abortion in 1955, she has had severe lower back and abdominal pain before and during menses, worse to touch. Scant menses. Overexertion brings bleeding and more severe pain. Cold leans while the lower abdomen feels hot. Leg soreness. Sweating on the forehead. Western medicine diagnoses are 1. Severe cervical erosion. 2. Retroverted uterus. 3. Chronic pelvic inflammatory disease. 4. Blocked fallopian tubes. Tongue edges are dark purple. Pulse conditions. Left side, deep and thin. Right side, deep, rapid, and forceless. Both chi, deep and choppy. Those signs indicate channel obstruction. Pathogenic products accumulate and block the uterus, obstructing the Cong and Ren vessels.
Syndrome concluded is accumulated stagnant blood obstructing the interior.
Thus, the treatment principle is to warm yang, activate blood circulation, and resolve stasis. Second visit. After taking herbs, pain initially worsened. Then, 3 days later, lower abdominal pain was less on palpation, but there was epigastric pain, borborygmus, and loose stools. Lower back pain and coldness, cold limbs, general weakness, dry mouth, poor appetite, poor sleep, numbness and cold sensation in the left head, tongue body slightly purple. Pulse condition is deep and thready.
Since lower abdominal pain has subsided,
Discontinue the downward attacking warming prescription used before and tend to regulate the liver and the stomach. The third visit.
after medical treatment,
The abdomen was no longer painful, and appetite improved. Lower back and leg soreness and coldness persisted. Dry eyes and mouth, shortness of breath, numbness and coldness on the right side of the head, easily awakened with many dreams. Urine and stool were normal. The tongue coating is dirty with slight purple edges. The pulse condition is, on the right side, chun is rapid and guan and chi are deep and weak. The left side, pulse is deep and forceless. The treatment principle developed is to warm the kidneys to transform qi. The fourth visit. Menstruation without pain, with a scanty amount and light color, mixed with small dark clots. The lower back soreness is mild but worsens after exertion. Both appetite and sleep are good. There is dryness of the mouth, borborygmus, and flatulence. Bowel movements occur twice a day, and urination is normal.
the tongue is slightly purple with no abnormal coating.
The pulse condition remains unchanged. Due to too low blood volume, it is advisable to invigorate the blood and regulate qi. The fifth visit. Menses has arrived on schedule with a larger amount than before, no clots, mild stabbing pain in the lower abdomen, lower back and leg soreness, and perineal dragging sensation upon standing. Epigastric tenderness limits her appetite.
Bowel movement and urination are regular. The tongue coating is not abnormal.
Pulse condition is deep and thready. The treatment plan is to warm the channels and activate blood flow. After treatment, all symptoms resolved. When studying this case, please note that the Western medical diagnosis differ significantly from the TCM approach
and should not be used as the base for TCM syndrome differentiation and treatment.
Modern physical and laboratory findings must not mislead us. Focus should remain on TCM ways of analysis of the pathogenic mechanism. Also note that at the patient's initial visit, the dysmenorrhea showed a pattern of mixed deficiency and excess, with excess predominant. Following the treatment progress, the pulse condition also changes, and the syndromes reached in the 5 visits are different. Pulse diagnosis in women is the same as pulse diagnosis in other orders. For women's diseases, syndrome differentiation and treatment are still based on the integration of the 4 examination methods, namely looking, listening, smelling, asking, and palpating, including pulse examination. And the TCM principles used to analyze diseases remain unchanged. If you find this video helpful, please give me a like, subscribe to it, and share it with others. See you in my next video. All the best!